How to get natural, safe results from facelift, eyelid surgery and rhinoplasty. Have you ever looked in the mirror and thought, I don't look quite like myself anymore? Perhaps you are a woman or a man in their 40s, 50s, 60s, and noticing some changes along the jawline, perhaps some jowls. My name is Dr. Julian De Silva. I'm a board-certified oculofacial plastic surgeon based in Harley Street in London, and I've dedicated more than 15 years of my life towards specializing in this kind of facial surgery. The face is really an intricate area of millimeters. Most of the time, what makes the difference between looking completely fresh and rejuvenated are really just millimeters, 2-3 millimeters in each area. So natural looking results, well, this really means that most people won't notice that you've had surgery. They just think you look refreshed. Now for women and men in their 40s to 60s, this often means lifting and tightening the lower part of the face, the jawline. Now for men in 50s and older, well, it's really about preserving structure and not overdoing the changes, particularly around the eyelid and the brow, because changes there can really feminize a man's face and you can really lead you to looking different. Now for younger patients, rhinoplasty or a smaller chin, those can be more about like having better facial proportions and a balance so that your nose, your chin just looks harmonious with your face. So the second thing is choosing the right procedure for you. Now for facelift and neck lift type changes, often there's sagging skin. Many patients have some degree of hypermobility or excess skin, and so it means lifting these lower parts of the face and neck. With eyelids, also known as blepharoplasty, often there's heavy changes in the eyelids which may be resulting from just loose skin, but sometimes there's also puffiness and bags in the lower eyelid area, which often has a slight genetic element to it as well. And then in terms of rhinoplasty, nose reshaping, sometimes there's also breathing issues as well. We're looking to improve the shape and appearance of the nose by preserving functional breathing at the same time. Now, a common mistake with facial surgery is choosing the wrong procedure for the wrong problem. A good consultation should clarify what is structure, what is function, and what needs to be done to improve each of these aspects to give the best possible result. For example, there's no point having a good looking nose that's a good natural refinement if it doesn't improve or at least preserve the breathing that you have. How do you reduce risks and disappointment? The first thing is, well, you really want to choose a specialist in that area. Many doctors may be performing a lot of body surgery, breast augmentation, liposuction, but then they won't necessarily have gained all the years of experience of doing lots of nose reshaping. You want to have a very clear idea of what you want to achieve from the surgery. And many of the patients who come to see me, they've thought about things for many years and they have quite a clear idea, but some patients are more in a thoughtful process and they're still in the early stages of development and they're still researching. But ideally you want to get to a point where you can really define what success is for you. Now for some people that might be 5 to 10 years refreshed. Sometimes patients come and see me and they're really looking to look 20 or 30 years younger. And so it's really important to know what you're looking to achieve, because then your specialist, your surgeon will be able to give you a good indication of what's going to achieve that. And sometimes it might be a number of stages or procedures that's going to ultimately make that difference. And of course, we now know nutrition is so important in health, so having a healthy diet, having sleeping well, well hydrated, all of these things make a good recovery and a good experience. Fourthly is really understanding the risks of having a procedure, because the reality is there is no procedure, whether it's non-surgical or surgical, that has absolutely zero risks or zero recovery. Sure, some patients can recover literally in days after surgery, but really some patients take more than days, and it can mean that you need to have a couple of weeks on hand to ensure that you have a fast and good experience. And then the final thing I would say is, well, your doctor's likely to give you quite post-operative instructions, and it's so important that you look to follow these instructions, because often these instructions will ensure that you have a speedy recovery and avoid certain issues. I would say the healing is not really down to luck. There's a certain strategies that we need to implement before surgery. For example, I give my patients very clear instructions on certain things they want to avoid. For example, Certain herbal medicines can thin the blood and give you more bruising and more swelling. And then during the surgery, well, certain measures we can take, like the use of sedation or twilight anesthetic, means that things like your vital signs doesn't change very much when you are having the surgery, which ultimately can result in less swelling and bruising. And then there are also things that can be done after the surgery. It might be the use of hyperbaric oxygen. It might be the use of lymphatic drainage to push away swelling in the neck and the jawline. It might be the use of LED treatment, like if you've had skin resurfacing, well, that LED will heal your skin faster from initial procedure. Generally speaking, patients who complete all of these three and are quite meticulous tend to heal faster and have like a much faster recovery and better experience. So next I want to go on to mindset and expectations. And now surgery generally will enhance your natural features, but it won't change them. So if you have certain things about your face that you've always disliked, it's so important to discuss those with your surgeon. A common thing would be asymmetry. Now, all of us have some degree of asymmetry, but some of this asymmetry can be improved. Some of this asymmetry is very difficult to improve. Now, if you had more or less volume on one side, with volume augmentation, with fat transfer, with lifting during deep plane or vertical facelift surgery can improve and modify that. Similarly, brow asymmetry, one brow can be lifted more than the other, and that will enhance that discrepancy. However, there's certain things that we just cannot change. So if one eye is above the other eye, well, that's imprinted in the natural bone, and it's so difficult to change that. And so it's important that you discuss what expectations you have from surgery so that your surgeon can give you realistic expectations and advice over what can be achieved. My philosophy is generally to give facial balance and harmony, and to listen to my patients carefully to understand what they are looking to achieve and ensure that we take measures to change those things. At the same time, we're looking to do the surgery only once and improve function whenever possible, preserve function, and to ensure that patients don't have dry eyes after procedure like blepharoplasty. They don't have like functional breathing issues after rhinoplasty. And so all of these things are important to take into account. So I do hope you found this information helpful. And if you have any questions or topics that you'd like me to cover, please do reach out to us, because I'm always looking to enhance education and information for my patients and for patients to make the best decision for themselves. I hope this has been helpful and useful for you. Thank you for watching.